We all may have experienced or may know someone who has had injuries involving the bone, muscles, or the joints and needing to see someone who could fix them. This is where the expertise of an orthopedic surgeon comes handy. Hello and welcome to the overview of the Department of Orthopaedics. By the end of this session, you should be able to understand and explain the functions of the department, identify the team players and their respective roles in the department, learn how time can be managed well while training in this department, recognize the roles and responsibilities of a house officer in the Department of Orthopaedics, understand and manage the expectations of being a house officer here, and last but not least, understand the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The word orthopedic comes from the Greek term orthos, which means straight, and pedia, meaning rearing of children. So the term orthopedics actually was originally used in the context of correcting musculoskeletal deformities in children. Up till today, we acknowledge the people who have aided the development of modern orthopedic surgery, Sir Hugh Owen Thomas, a surgeon from Wales, and his nephew Robert Jones. You will come across the famous Thomas splint used to stabilize fractures today. It was during the First World War that Thomas's techniques come to be used for injured soldiers on the battlefield. Now this brings us to the function of the department. Orthopedics is a branch of surgery which deals with the musculoskeletal system, specifically disorders of the bones, joints, muscles, ligaments, tendons, nerves, and skin. Common cases involved are trauma, fractures, degenerative diseases of the joints and intervertebral discs, infections of the bone and joints, tumors, to name a few. Well, many might understand orthopedics as a department which focuses on fixing broken bones or misaligned joints. How about we take a quick look at the other also common conditions which fall under the department's purview, such as sports injuries like tendon injuries, muscle sprains and strains, back pain, limb lengthening, osteoporosis, arthritis, and infections of the legs and hands. So, the function of this department can be briefly summarized into the diagnosis, the correction, and prevention and treatment of patients with musculoskeletal disorders or diseases. There are numerous staff and service providers working together in the orthopedics team to ensure the objectives of the department are met. It is advisable to be well aware of who your team comprises of and what are their respective roles as part of the orthopedics team. Let's begin with the doctors, the head of department or the HOD. The department head usually holds a post of a consultant, otherwise the post can also be held by a surgeon in training. The HOD runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The HOD represents the department to important meetings, raising issues to the attention of the hospital director and manage the department's budget to ensure adequate medications and equipments are available. So if you can understand, it is more of a department managerial role. Next would be the consultants or the surgeons in training. So the ward consultant surgeon leads ward rounds at least once a week. The consultant oversees the patient's diagnosis, investigations and treatment plans, and also helps troubleshoot difficult situations. How about the surgeons? Well, the surgeons conduct pre-operative and post-operative ward rounds daily. He or she leads a team of doctors during the rounds. The surgeon's main role is intervention in an operative or a surgical approach. New cases which are admitted from the clinics or the emergency department are reviewed by them, and the surgery is decided based on the severity and the diagnosis. He or she then concludes the management plan and conveys the progress of the patients to them and their families. Also take note that the surgeons or specialists here will be your assessors at the end of your posting. So they will also supervise teaching and CME sessions. Next, we have the registrars, or also known as the senior medical officers. And the medical officers themselves. So the medical officer in the ward is your one-up who reviews the patient with you before the surgeon arrives. It is advisable that the house officers bring forth any setbacks pertaining the patient's care or management that he or she may face to the medical officer in the ward before the surgeon arrives. How about the nursing staff? So the nursing staff in every department is led by the matron of the department. The matrons are in charge of the nursing service division and are directly accountable for the proper organization, direction, and coordination of nursing services. They are the nursing representatives of the wards to raise issues to the hospital director. They will arrange and organize staffing requirements and other resources needed by their wards. They are usually dressed in dark blue colored nursing uniform. How about the ward sisters? Well, the ward sisters organize all nursing activities of a unit in accordance with hospital policies and rules. They directly supervise patient care of the unit and provide direct care to seriously ill patients as and when a situation arises. The ward sister is also in charge of looking after the well-being of the nursing staff team. She or he manages and arranges the rosters for the nursing staff team and help the nurses carry out their duties if the wards become too busy or overwhelming. Next, we have the nurses. Nurses can be divided into staff nurses and community nurses, or also known as Jururawat Masyarakat, JM. Ward nurses provide direct patient care. They are responsible for obtaining patients' vital parameters and charting them on the observation charts. They will take over the charge from the duty nurse of the previous shift regarding patients bed to bed, instrument supplies, drugs, and hand over the same to the next shift. Every day, one of the nurses in the ward will be assigned the medication administration role and will be stationed by the medication trolley to prepare and dispense medications to the patients. Now, let's have a look at the allied health professionals. We have the pharmacist. So the ward pharmacists follow the ward rounds led by the specialist or the consultant and provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. You may require the assistance of the ward pharmacist to verify the medications ordered to prevent medication errors. Next would be the support staff. So we have the clinical assistants and the lab assistants. The clinical assistants are involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and to maintain the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring menu choices are complete. They are in charge of dispatching bloods, urine or stool specimens in biohazard bags from the ward to the lab counters. And essentially, they also take care of patient lifting and transport. How about lab assistants? Well, they prepare specimens, match blood compatibility for transfusions, analyze fluid chemical content, and collect blood samples. Technicians are expected to handle sophisticated lab equipment, including cell counters, microscopes, and automated analyzers. So you and your ward team highly depend on them. Having a smooth relationship with them enables communication to work well to ensure specimens dispatched to the lab and processed promptly, and the results are then communicated back to you as per the stipulated time frame. Next, we have the imagers. Imagers, also known as radiographers, are certified technicians who capture images of organs, bones, and tissues for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and the interpersonal skills necessary for patient care. So how do you fit in with them? You will be coming into contact with radiographers while accompanying patients to their radiography suite. You may need to assist them with the patient's mobility and positioning patients for imaging. Next, we have the record keepers or the IT technicians. They are responsible for the maintenance of patients' medical records and the system. They must safeguard medical records from tampering, loss, and unauthorized use. They are responsible for seeing that the patient's right to privacy and the confidentiality of the information stored within the medical record is maintained at all times. So, daily documentation and completing discharge summaries are important roles you play as a house officer. Ensuring documentation is appropriate and well done can assist the record keepers to organize and store them well for record and reference purposes. Next, we have the telephone operators. So, to ordinary people visiting or calling into a hospital switchboard operator seems to be doing mundane work. In actuality, these people are wholly responsible for all the communication that goes on in a hospital. Telephone operators are responsible for answering telephone calls, taking messages, transferring calls, and ensuring that emergency services are coordinated in accordance with the nature of the emergency. They screen calls to ensure authenticity and make sure that any messages are communicated to the correct recipients in a time-efficient manner. So you will be dependent on the operators to connect phone calls within and out of the hospital. Good communication can be ensured if you are courteous and concise with your calls. Next are the support crews, who are the housekeepers and cleaners. The role of housekeeping in hospitals is to ensure that all areas, including treatment and surgical rooms, patient rooms, labs, and public areas, are kept clean and sanitized. Their duties include mopping, vacuuming, sweeping floors, cleaning the windows, dusting furniture, washing, and changing linens of patients' beds, and ensuring that all waste is disposed of properly. You and your ward members depend on the support crews as they keep your ward clean and safe from biohazards. You can play your role by ensuring sharps and wastes are discarded well and pose no danger to the housekeepers. Now, how about the operating theatre? Who are the team members here? Let's begin with the scrub nurse. They scrub in earlier than the doctors or the surgeons to arrange instruments and complete the instruments count with the circulating nurses. They help surgeons clean and drape the surgical site under aseptic technique. They focus and aid the surgeons in procedures and operations. Circulating nurses. They receive patients from the ward in the OT airlock area. This is where they double check patients' details. They assist scrub nurses to prepare extra instruments as per requested or needed by the surgeon. Next is the recovery nurse. They stand by in the recovery bay to observe post-operative patients. They check the patient's details again post-operation and ensure all the ordered medications are given. They record all the observations and inform the anesthesiology medical officer to review the patients before sending them back to the wards. Next is the in-charge OT nurse. So they make sure all elective patients are called to the OT as per schedule. They write patients' details booked for emergency operation in the emergency operation forms. They receive patients from the ward or ED in an airlock area. And finally, we have the anesthesiology team. They will be dealing with the patient's airways and they will make sure the patient is optimized during the surgery. They will monitor the patient's vital signs and inform the surgeons if anything needs to be done pre, during, or post-surgery. Now, let's quickly run through a flow of patient admission to the orthopedics ward to get some clarity. Patients are admitted to the wards either from the department's outpatient clinics or through the emergency department. First, through the clinic visits. Here, new cases which are referred from other centers or follow-up of existing patients make the bulk of the cases. In the clinic, you will be tasked to clock new cases, to do a follow-up review on existing patients' progress, and perform necessary tests or procedures if needed. If admission is indicated, the patient is then admitted to the ward. Similarly, in the emergency room, as the patient comes in or brought into the emergency room, triaging is done where the type and the severity of the condition is assessed and determined. Based on the triage level, patients will be moved to the appropriate zones. Any diseases or disorders involving the upper, lower limbs as well as the entire back, referral to the orthopedics team is usually considered. Upon receiving the referral, the team then decides the classification of the conditions, which are usually largely grouped into trauma-based or non-trauma-based. The representative team members, which includes the house officers who are stationed at the emergency department, will review the patient by taking a detailed history, performing a physical examination, and interpreting relevant imaging studies of the affected area. Again, if admission is warranted, then the patient gets admitted to the ward in the same way. As the patient is admitted to the ward, the house officers now have the first few contact encounters with the patient. Here, you are expected to review the progress of the patient from time of presentation to the emergency department, identify any new issues, request imaging studies, carry out procedures, place medication orders, and execute the pre-operative plans given by the operators. You also play a major role in posting a case for surgery to the operating theatre team and the anesthesiology team in order for them to get a pre-operative review done prior to surgery. Communication is key, and you should touch base with the OT team to receive important handovers to be carried out post-surgery for the patient. Finally, in the operating theatre. So here you are responsible to assist the surgeon in positioning the patient, ensuring any wound dressing over the patient is removed to provide a clear area of surgery. You are expected to scrub in for the surgery to learn not only how a surgery is conducted, but also to experience being in an operating theatre, as the environment is completely different from the wards and the clinics. Upon completion of the surgery, you could assist your surgeon with the documentation of the procedure. As a responsible house officer, you are encouraged to always communicate with the ward team as to whether there is anything to watch out for as the patient arrives back to the wards. Or probably there are some specimens which are to be ordered by the ward team and that needs to be communicated to them. This chain of communication is very important to ensure plans can be expedited with reduced mishaps. Now let's get into the exciting part, time management. It is extremely crucial to reap the maximum benefit of training during your housemanship. Let's look at a few general tips on how you could organize your tasks and use your time wisely. Tip number 1. Create a job list. Make a customized table to summarize your ward works or tasks systematically. Prioritize work that needs to be done within office hours. Requesting imaging, requesting special bloods which needs specialist authorizations and referrals has to be done before 2 p.m. preferably. Cross out tasks that had been carried out to avoid confusion between colleagues. And finally, delegate your tasks among you and your colleagues such as blood taking, referrals, requesting, imagings, assisting MOs in procedures, and many more. These will ensure that all your tasks or jobs can be complete within the stipulated time. Next, familiarize with your patients and their surroundings. Allocate at least 10 to 15 minutes daily to review your patients. Remember the important things about your patients and the significant results they have. Check necessary parameters and attachments on your patients, such as wound dressings, vital signs, medications. Do not only focus on the orthopedic reasons. You will need to see the patient as a whole and highlight changes or worsening conditions to your medical officer or specialist during the rounds or immediately if it's urgent. Save necessary emergency contact information for the day, such as the surgeon or medical officer in charge or on call, as here in Malaysia we do not have a pager system. Next, take turns with your colleagues if you wish to take a break, such as to eat or pray or even take rest. And notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. If you're working in the OT on a particular day, make sure you have your breakfast first, as you may not know how long or if the operation you need to assist may be prolonged. Be early to reconfirm your patient's cases which have been scheduled for elective operating theatre. Write patient's details on the board. Prepare medications such as diluting antibiotics. Prepare the template for your op notes to save time in between each OT sessions. And finally, use electronic or digital productivity tools which most of you might already have in your daily usage devices such as your smartphone, iPads, or a digital notepad. Utilizing the reminder, notifications, and planner apps or systems can not only save your time but also ensures tasks are completed. Apart from that, you do not need to worry about documentation because you can always refer to the information or case stored previously. Now, what should you expect as a house officer in this department? You will also have the days where you'll be working in a cold OT to assist your surgeons, but you might need to use more of your energy to help maneuver the patient if needed. Not to worry, because your medical officer or the medical assistant available will always be there to assist your surgeon. Orthopedic surgeries can take long hours depending on the type of operation or procedure done and if it gets more complicated intraoperatively. Just like any other surgical rotations, your ward rounds will start early as your surgeons will need to prepare for their OT by 8 or 9 a.m. Your duty starts at 7 a.m. and therefore it would be advisable that you come in early to review your patients and discuss any problems regarding patients during the ward rounds. Before the rounds begin, for those patients with wounds or post-operative wounds that need to be reviewed, you need to remove the dressing and cover it with a sterile green cloth. Take note of all the plans given by the surgeons so that you will not miss a thing. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it later. So, how does one get into the local master's training program? Upon completion of housemanship, you need to be working as a medical officer for a minimum of 3 years with at least 3 SKT scorings above 85% each. In this period, you should have passed the Medical Specialist Pre-Entrance Examination or MEDEX and Basic Sciences which are mandatory. With the stated qualifications, you can then proceed and apply for Hadiah Latihan Persekutuan or HLP, which requires at least minimum 3 years of experience in the said department. So upon selection, you will join the local master's training, which spans for 4 years in total duration. Alternatively, one may sit for MRCS Part 1 and 2. However, to complete your training, you may need to apply for a period of service in other countries which recognize this training pathway. Singapore is also a recognized center for MRCS Part 3 training, which you can't do in Malaysia. So if you have MRCS Part 1 and 2, you can then proceed to Singapore to finish your MRCS training and sit for Part 3. This is the list of recognized postgraduate qualifications in Malaysia in orthopedics. These are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered orthopedic surgeon in Malaysia. You may find this list on the Malaysian National Specialist Registry website. How about further subspecialization? Well, there are pathways which can be considered, which include the recognized pathway via Ministry of Health, which lasts for 3 years and can be applied after 2 years post-general specialization. And an alternative pathway to obtain your fellowship is through a short period of attachment, which is usually for 6 months to 1 year at any relevant place overseas. And finally, a little bit of the subspecialties in orthopedics. We have spine surgery, arthroplasty, sports surgery, hand surgery, advanced musculoskeletal trauma, pediatrics orthopedics, oncology orthopedics, and foot and ankle surgery. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding roles and responsibilities of a house officer in this department, what is expected out of you while you are on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those who are keen to join this field of surgery. Now, let's take a look at the resources for training. There are plenty of online resources available to assist with your learning process while you are in training as a house officer in this department. So you are encouraged to be resourceful as it makes your job easier. Here, we will be going through some useful resources to aid your quest for department-related information and skills training. Let's first start off with the NICE Trauma and Orthopaedics Guidelines. This resource page contains links to NICE guidelines for the management of orthopedics in these following subspecialties. The guideline also has quality standards, interventional procedures guidance, and technology appraisal guidance relevant to different areas of trauma and orthopedics. You can also find training videos and screencasts on their site. So check it out. Next, we have on the list is the Clinical Practice Guidelines by our Ministry of Health on diabetic foot. Diabetic foot ulcer is a common condition which you will encounter frequently in this department. Having a good understanding of this disease and the complications it can cause will serve you handy as you encounter these cases in the orthopedics clinics, wards, and the emergency department. It was last updated in 2018, so don't miss this out. Next is an essential summary put together by a group of doctors not many years ago. The interesting concept of a quick reference guide which is used here is helpful for immediate reference and recalling classifications. It comes in a form of a PDF. Geeky Medic's Orthopaedics Note. So it's a part of a compendium of a comprehensive collection of visuals, notes, flashcards, and many more interesting learning tools online for the Department of Orthopaedics. Geeky Medics has an extensive compilation of clinical skills videos to assist doctors in training with their learning. How about YouTube channels? You could check out Dr. Nabil Ibrahim's channel. He is the chairman of Orthopaedics and Residency Program Director at a notable university in the United States of America. Dr. Ibrahim is very involved in orthopedic education and research. He has great passion for education and his videos clearly reflect his teaching techniques. His goal is to spread orthopedic education to the whole world. Next, we have What's New in Orthopedics. The aim of this channel is to help you stay focused on emerging orthopedic technology by providing you exclusive access to exciting new orthopedic surgical techniques, presentations, and animations. And finally, we have Conceptual Orthopedics. This channel showcases good orthopedics practices and procedures demonstrated to you by a large group of orthopedic surgeons. So do check this out. Well, we have finally come to the end of this session on the overview of the department. Hope it was insightful and stay on for the next sessions with us. Thank you.